Hello and welcome to One Take. I'm Dale Kirshner. One Take is a brief discussion with one CEO providing his or her take on how to best deal with the most pressing business challenges of today. It's also called One Take because this is one continuous dialogue where we have no editing done afterwards. So you're hearing it directly from the CEO. One Take is brought to you today by the Platinum Group, which for nearly 40 years has specialized in helping business leaders navigate through challenging times ranging from selling their businesses, raising capital and refinancing, to surviving tough legal or HR, financial, and other types of challenges, including crises. Today, I'm pleased to welcome to One Take Manny Villafana, a godfather of the Minnesota medical tech industry who created a few companies you may have heard of, such as Cardiac Pacemakers and St. Jude Medical. He's a multiple-time successful serial entrepreneur who has taken 7 companies public, and he's working on yet another venture called Medical 21. Manny, welcome to One Take.
Good morning. Pleasure.
So you've been through several economic turns over the last 50 some years. What's different about what you're seeing today in the COVID economy? And any tips for business folks who maybe haven't seen as many things as you have over the years?
Well, first of all, let me just say thank you again for inviting me. And if we can reach anybody and help them, we've done our job. But talking about the COVID, let's kind of remember a little bit about the recent recession that we had back in 2008, 9, 10, and 11, which was hard on us. And in fact, one of my companies was personally affected by that downturn. In that situation, we had a severe economic downturn, but we had the ability to try to raise capital and things like that by talking and hugging and kissing, as I always say, and having lunch and meeting people to raise capital. I think on this one that we're presently involved with, in which we have a downturn, but we also have, more importantly, a COVID-19 situation, a pandemic, which has caused us and forced us to be separate from the people that we want to reach, talk, our potential investors, our potential doctors, and things like that. It's been a very difficult time. And of course, as a young entrepreneur, not that I'm talking about myself, but for the young entrepreneur, it is a challenge because to raise capital, I don't know how to raise capital without being face-to-face, holding hands, shaking hands, having a lunch, a dinner, and having a direct interface. We talk about using virtual connections through a variety of connections on our computers, Zooms, and other Microsofts, and all the other kinds of forms of communication. But still, you cannot replace the one-on-one connection with a potential investor. So how do you do it? I'm still working on it. Right now, I have a company called Medical 21 in which we are trying to raise capital. And the challenge every single day is, how do we do it without touching direct base, face-to-face, with a potential investor?
Well, what do you think it is that from those direct, actually having a chance to sit down, have lunch, break bread, shake hands, what is it from those things that you think are so valuable that could possibly be used in a Zoom meeting or something else? Is there anything you can think of that could be extracted from those in-person meetings that we could use today through technology?
I don't know about you, but I find it very, very difficult to think of how I can ask someone for $250,000, $500,000, something like that, to put into a company in which the individual, maybe for the very, very first time, is talking to me, interfacing with me, and things like that. And I don't know how to do that. I mean, I have raised capital many, many times. You even mentioned that I've done 7 IPOs beforehand. But as we approach our company now, and we hope to do an 8th IPO, if that's the way we're going to go, it is difficult to do it virtually. And to answer your question, what can we bring from holding hands and lunch and coffee and things like that? I really don't know. Other than the familiarity and saying, hey, I apologize that all I got is a virtual connection with you and not, an actual face-to-face sit-down meeting.
Yeah, it's interesting. A lot of the meetings seem to also start out with people talking about what they're experiencing nowadays. And I don't know if that's a good way to go with trying to humanize some of this technology. But yeah, I think a lot of people are grappling with that. And Manny, when you think about other things that you've seen, you've led people through all these different ventures of yours. What about leading people today and keeping people fired up and focused? What are you doing and what are your folks doing, your leadership folks doing to keep people fired up?
Well, I think it's very important, more than ever before, that the leader, the CEO, interface with the employees, with his staff, with his team, with her team. Uh, the, you know, there are so many challenges. The employee has challenges at work, at home. He just doesn't go to, he or she doesn't just go to work, 9 to 5 or whatever it is. It's a constant, almost a 24-hour a day situation because many of them are working at home. Many of them are working where they're constantly being bombarded by outside influences. So you got to get everybody together once in a while. And again, face to face, and touch base with them and tell them the good things and the bad things. We are here at Medical 21 developing some extraordinary technology, things that people say couldn't be done, and we're going to do it. But you got to fire up your team. And when there are times when things are not going well and we have to make changes and stuff like that, I bring about a lot of history. If you are an entrepreneur who's had previous experience and previous successes, then bring it out to your employees. I talk many times, for example, when we did St. Jude Medical, where we developed an extraordinary valve, and again, a valve that people say couldn't be done, and we did it. I explained that when we were doing it, we had a lot of challenges. We had a lot of reiterations. We had a lot of design changes. It took 26 iterations of the St. Jude valve before we finally got it just right. And so when we go through as we're developing an artificial graft, we've gone through changes, we've gone through iterations, and I keep remembering, hey guys, we're only doing number 9 right now. We did 26 when we did St. Jude. We have to continuously motivate them because they see around them, are we going to have jobs? Or what about my family? What about, I can't even see people because of the corona. They need any kind of support. And also, if you can, I do this now. I have a very small team, but I also believe in this interface so much that every so often, come on, let's all go to dinner. Let's all have a nice, anybody who knows me, I'm involved with Manny Steakhouse. Let's go and have a nice steak. Let's enjoy it and relax. Let's get together as a team as much as possible because they have so many things happening to them that are going to distract them from what we're trying to do.
So what have you been able to do, with the COVID situation? Have you been able to get together in person with people, maybe, 6 feet apart, everybody wearing masks? I suppose you haven't been able to do dinner.
Yeah, in our company, first of all, we went almost directly, I wouldn't say directly, but almost directly to the governor and said, look, we got to be classified as an essential business. Somebody said to me, well, Manny, why can't you do this business at home? And I said, well, yesterday we dissected a heart of a sheep in our research work. And I said, I don't believe that my wife Elizabeth would allow me to do that on a kitchen table. So we got declared essential so that we can continue to do our research work. Okay. Now, once we were together, and we know we can't be 6 feet apart. We're holding animals, we're doing things, we're working with materials, we're working hand in hand. I sat down with the group and I said, look, here's the facts of life. If any of you are uncomfortable working in such a close environment, working under these situations, you're more than, you're free to go. You're free to leave the company, but bear in mind that by leaving the company, it's sort of like taking one of the wheels off the car. And when you lose a wheel, particularly when you're going up the side of a mountain, you don't want to lose a wheel because you're going to crash and burn for sure. And I just basically told them that fact of life. And they kind of realized, hey, we got to hang in here. Now, obviously, if at any time any of our employees feel that, I'm just uncomfortable, okay, they can leave. We have taken steps, of course, here to try to minimize to an absolute minimum of any visitors and outside influences while we're doing our research work. We've been able to accomplish that. And the team, strong team that we have hung together. We respect each other. We say we have to do our very best when we go out, when we go home, or wherever we go, to be careful, because it's not only going to affect you personally, but it's also going to affect our team members, which in turn affect the outcome of this company.
Yep. Just out of curiosity, were you able to tap the payroll protection program?
Yeah, we got a little bit of money. Some of our employees are consultants, so we could not tap that, but we were able to get a little bit of money, which has helped us. And of course, if it comes around again, we're going to be first online. I can tell you, because we do need money, and it's hard to raise money.
Thinking about all the experience you have starting companies, I've seen some reports elsewhere where people say now is a great time for people to start a company, or there are others that are already doing it, seeing that there are some opportunities out there to kind of fit into this new economy that's taking shape due to COVID-19. What are some thoughts you have that you could share with people in terms of do's and don'ts when it comes to starting a company?
Well, again, the do's and don'ts. There are some very basic do's and don'ts. First of all, and foremost of all, if you're going to be the young entrepreneur that's going to start a company, make sure that you first bring in your family. Bring them into the fold and tell them, honey, guys, Dad, Mom is going to start a new company, okay? And then, of course, your spouse is going to say to you, Manny, do you understand that if you leave your job, you don't get paid? And so who's going to pay the mortgage and the kids' education, put food on the table? Oh, and I forgot to tell you, I'm pregnant, okay? So all of these things are the very, very first things. You have to understand the decision of trying to do your own company is not going to affect you as much as it's going to affect your family. Okay, that's the first thing. Secondly, you better understand the risks that are going to have to be taken. And today, in an environment in which, particularly in a regulatory environment, where there is such an adverse mentality towards risk, it's hard to take risk, but you're going to have to take risks. I mean, the project that we're working on is something that people have tried for years. People has never been able to do it, but we're going to take the risk and go after something that has never been done before. And we've done this, we've always done this. I mean, when we develop pacemakers and heart valves and stents and all these medical products, we were doing it at a time when people say, Manny, you're crazy. It can't be done. But we went and we did it, okay? I still remember when we were doing the very first pacemaker, and pacemakers only lasted maybe 18 to 24 months. And I said, we're going to make a 10-year pacemaker. One guy said to me, he said, Manny, I don't know what you're drinking, but give me a case of it, because it must be really powerful to blow your mind the way, whatever you're thinking about. And what did we do? We made a pacemaker, and the pacemaker ran not 10 years, but rather 30 and 40 years. My mother, who received one of our very first pacemaker, the pacemaker lasted 36 years. Uh, and a variety of different things like that. So be prepared to take risks. And then, of course, be prepared for all the naysayers who will say, Jane, you're crazy. Mary, you're crazy. Charlie, you're crazy. Manny, you're absolutely crazy. So remember that.
How, you mentioned before, you're not a young entrepreneur, but I still think you're one of the youngest entrepreneurs I know, because you have this stamina. You keep at it, and you've had tough times, lots of tough times, and you've had lots of successes. How do you keep the energy going, and how do you keep fired up after you do get bashed several times sometimes with
Look. Let me just say this. For me, the greatest pleasure in life is to do things people say cannot be done. Okay, I don't go after a little widget and improve on a little widget. I go after things that say, Manny, it can't be done. Let's try it. Let's go a different direction. In fact, the company I'm working on now, Medical 21, I really was going to name it Medical 180, but nobody understood what the 180 meant. And of course, the 180 typically means that you're going to go the opposite direction. And that's what we've done in development of what we're trying to do now in artificial graft. We have gone a different direction, the opposite direction, and trying to make this. And I think it's going to work. I mean, we have animal work now that's looking very good. We anticipate to begin our clinical trials in, let's say, at the first half of the new year, early part of the next year. We'll be doing these things. And this is something that is so needed. That gets me excited. Why wouldn't you get excited? Okay? I get up early in the morning. I'm up at 5 o'clock in the morning. I go to the gym, 4 or 5 times a week. Okay. I work out hard. I have a breakfast with some guys, men and women that are sharp, really, really sharp, with a diverse background, legal background, scientific background, marketing, etc. And we have a little breakfast, and it just gets the mind going. And then I go to work. Okay. And I work with a fabulous team that is all on the same page. We're all trying to do the same thing. And for people who have invested in us in the past, or most of them, they have made a very fine, I wouldn't say a pot of money, but they made some money of which they've been able to help other people. I mean, our family uses a lot of what we have made and given it away. We're helping people. So you're developing products that are needed. You're working with great people. As a result, you can help other people. I don't know about you. I enjoy my life. I have a wonderful family. I have a lot of energy, and get out of my way.
That sounds good. Also, the old adage, go big or stay home.
Yeah, right.
Manny, any other thoughts in terms of tips for business leaders, entrepreneurs, anybody else right now who's trying to do the things that you're talking about and stay fired up, but facing some pretty significant challenges, right? Because of COVID-19, but also because of the economy and all the uncertainty out there.
Yeah. We always have challenges ahead of us, but I agree that we have some right now that are very, very big. Okay. The COVID-19 came out of nowhere, and it has affected everybody, men, women, children, adults, and so it is a big challenge. But the other ones have always been there. The adversity towards risk, taking risk. I mean, it was our friend, Dr. C. Walton Lillahei, the great pioneer in cardiac surgery, who said to me in a conversation, he said, Manny, risk must be taken. Because if you don't take risk, nothing happens. And it's so simple. And then, of course, the risk of money. I don't know what it is. Sure, if you're hitting home runs every single day, they give you money. But if you strike out once in a while, all of a sudden, you're not God anymore. And they say, well, can you do this? And I said, I think I can do it. And we try to do it. And we've been pretty successful. Okay. And there is such, when the markets go down, people just, I don't know what it is. They hold on to their money tighter and tighter, as if I had anything to do with the market. No, we're doing a technology that, if we're successful, will be big and people will make money. Now, the last risk is the regulatory risk. It's easy for regulators to say no, hard for them to say yes. If they say no, they can't get in trouble. But if they say yes and something goes wrong, they're in trouble. I can understand that. But again, I remind everybody, if we don't take risk, nothing is going to happen.
Well, I think that's a good note to end on. Manny, thank you very much for spending some time with us today on One Take.
Thank you very much. I appreciate it. And Dale, let's go and break some bread soon, will you? I love you on the screen, but I love you when you buy lunch from me. Okay?
That sounds good. And I want to thank our sponsor once again today, the Platinum Group, which for more than 40 years has helped companies through turbulent times such as this. If you could use some help or just a second opinion on something, contact the Platinum Group. You can find out more about them at theplatinumgrp.com. And I want to thank all of you for tuning in today. We'll see you next time on One Take.
I kind of set up the screen. So in the back of me, there was that pictures of some patents that we did, patents on pacemakers and heart valves and stents, and stuff like that. I almost pulled out the old saying that here's a hockey puck. Okay. In fact, it was a hockey puck. My daughter, when she was playing hockey, and I was saying that pacemakers were bigger than hockey pucks. Here's a pacemaker, and that's one. And here's another one. This is both of them are old Medtronic pacemakers. Okay, and we made them, and we now make pacemakers. This was the first pacemaker I made, the lithium pacemaker, which was actually small, half the size of a hockey puck and half the thickness. And then I also had this pacemaker, which is the one that my surrogate father received, which is much, much smaller.
Were both of those at Cardiac?
Yeah, the ones that I showed, the big ones and the small one, are Cardiac Pacemakers. Okay. CPI, which became Guidant, which is now Boston Scientific.
Yep. And I can actually do a screen grab off of what you just showed because we're still recording, so I can actually do a little.
You're still recording? I didn't know that. It's a good thing I didn't use any language. Okay.
Well, it's not live, so that's good. Oh. But no, I can do a screen grab and still use that. That'd be great.